Hi, my name is Catherine Lopez, and I will be talking about atherosclerosis. So as we begin, I will show you the normal blood flow of the heart and what happens when this disease process happens. So now the normal blood flow of the heart, we go through our right atrium, through our tricuspid valve to our right ventricle. We go in and oxygenate all of our blood, come back through the pulmonary veins to the left atrium, to the left ventricle through our mitral valve, out through the aortic valve to the aorta and the rest of the body. That's normal blood flow. When we have atherosclerosis, which is a disease of the large and intermediate arteries, there are lesions that develop. And in these lesions, they get stuck to the arterial walls. So what happens? There's an initial injury, usually by hypertension, some type of injury that starts to form. The macrophages will come in and try to fix it, but the macrophages then they form fatty streaks, and then an intermediate lesion that leads to fibrous plaques, and then as the fibrous plaques continue, they will calcify. Calcification that could lead to occlusion that leads to myocardial infarctions, and if it's not occluded, then it can also rupture. Ruptures leading to emboli or strokes. So how does this happen? How do we know that it's even happening? We can start by seeing that if we are hypertensive, if we are diabetic, if we're getting peripheral artery disease, if we're having angina, those are disease processes that occur because of atherosclerosis. So we get tested. Our lipid panels are tested. Our cholesterol panels are tested. We also can get EKGs done to check to see if there's any prior injury that has happened that we didn't know about. It'll be shown on the EKG. And then also we can get stress tests done that'll measure both our blood pressure and our EKGs at the same time to see how our body is reacting to the stress of exercise. So treatment, what's our biggest treatment? Our biggest treatment is prevention. How do we prevent atherosclerosis from happening? It's through our diet. Our diet we can control. We control the glucose intake, we control the lipid intake, we control our cholesterol intake. Diet is our modifiable factor that we can completely control. We can also control our lifestyle. Exercise, having a regular physical activity to exercise also helps that. But if we can't control it through diet and exercise, we have to control it through medications. There are different medications that the physicians can prescribe to help to decrease our hypertension. So different medications that they will prescribe are vasodilators. What kind of vasodilators do they prescribe? They will prescribe angiotensin converting enzyme inhibitors, our ACE inhibitors. These are our captoprils, our lisinoprils. They act here against the, to block here in this regimen here. And then they also order the angiotensin receptor blockers, our ARBs. They also prevent vasoconstriction. They are decreasing the peripheral vascular resistance. They can also prescribe calcium channel blockers that will decrease the amount of calcium, so that decreases the contractility in the heart. They will also prescribe beta blockers. Beta blockers can decrease our beta adrenergic receptors. They will decrease our epinephrine, decrease our adrenaline, decrease our fight or flight response. So that decreases our heart rate and decreases our workload. So in order to prevent the hypertension, they order these vasodilators and these beta blockers. In order to control the hyperlipidemia, they can also order medications. They order statins. The statins, they inhibit the HMD-CoA reductase, so that this inhibits the actual cholesterol synthesis. It'll increase our LDL receptors and then decrease our LDLs up to 25 to 50%. But there are actual natural ways to decrease our lipids. There are different agents in foods like oat bran that combine with our bile acids in our GI tract that prevent the reabsorption of this cholesterol, decreases our bile, and actually can increase the liver cholesterol so that it doesn't reabsorb in the system, creates new bile, so it doesn't create that new LDL, and so that we can do this naturally in our system. So we can do it through diet of the oat bran, or we can actually do it through medication with our statins. So this process can be helped. We can use it through diet and through the medications, so that if we have a decrease of 1 milligram per deciliter of our LDLs, then it can decrease our mortality by 2%. If we cannot control that through our diet or exercise or medication, then we actually have to go through the process we'll speak about next week, which is cardiovascular surgery. So thank you.